Hello everyone. Recently around 12 people died after a viral outbreak in Kerala in southern part of India. And in that 12 people there was a nurse. While taking care of the patient, she contracted with this virus and got infected and she passed away. But on her deathbed, she wrote a letter to her husband and she wrote it this way: I'm almost on my way. I don't think I'll be able to meet you again. Please look after our children. Take them with you to the Gulf. I'm sorry. Don't be all alone like our father was, please. With love. The story almost brought me to tears. Her body was cremated in an electric crematorium back in Kerala. And her children couldn't get to give their mother one last kiss. We as a medical fraternity in solidarity, we admire her bravery, her exclusive devotion for her work. She is a hero. She is definitely a martyr. She will always be remembered in our hearts. But I want my Indian friends to know about this Nipah virus and this viral outbreak, how it is, what is this virus and how it is spreading. This virus causes zoonosis, and zoonosis is basically diseases or infections that are transmitted from animals to humans. And this Nipah virus, the reservoir, the natural host of this virus is fruit bats. So these fruit bats shed this virus in their saliva, in their semen, in their urine, as well as in excreta, basically bat droppings. And the intermediate host are pigs. So when these pigs are infected, they are also highly contagious. And back in Malaysia, in the year of 1999, around 100 people died because of this viral outbreak, and also around 200 people got infected with it. So contact with this infected pigs can also spread it. And also, drinking this fresh date palm sap, which are possibly contaminated by fruit bats, and also mangoes, mangoes contaminated by fruit bats can also cause this Nipah viral infection. Now, we should know what are the symptoms, if you are infected with it, how it presents. And usually it starts after 5 to 15 days of exposure. You present as a viral episode in which you have a fever, weakness, malaise, you feel tired, and also it can progress to encephalitis. That's the worst thing. In encephalitis you have inflammation of brain, which will present as headache, drowsiness, confusion, vomiting, nausea, and sometimes it can go on to coma and eventually death. And sometimes it presents as respiratory distress. You feel severe difficulty in breathing. We must know it in order to, if you have such presenting symptoms, so that you can go and meet a doctor, you can consult a doctor. Now, the treatment or the cure or prevention, how we can prevent this viral spread, there is no definitive treatment. So we should try avoiding contact with these infected pigs or with this contaminated mangoes and contaminated this fresh date palm sap. Try to avoid drinking it, and also avoid contacting with any animals infected with this virus. And if you feel any symptoms, try to consult a doctor. And there is no cure, but just we give supportive care, intensive supportive care, like we hydrate the patient. If the patient is dehydrated, we treat for vomiting and for nausea. That's it. So I want my friends to know how to avoid it, And I also want my friends from India try to share it as much as possible, so that people in southern part of India, especially in Kerala, they may know about this viral spread, how it is spreading, and they may also know how we can prevent it, because try to avoid it, how we can prevent this viral outbreak, and so that less number of people can contract this. So try to share it as much as possible. This is an informative video, so try to share it with your friends, and that's it. Thank you.